diabetic retinopathy examinations on behalf of payers throughout the United States, currently looking at Asia and other markets as well. Jim, please. Diabetes, leading cause of adult blindness. It is asymptomatic. It's very difficult for physicians to convince their patients to go in and get this examination provided. So it's a struggle constantly. It is treatable with early detection to the 90-plus percentile level. National patient compliance rates are exceptionally poor, and more quality is becoming the benchmark as it relates to reimbursement for the insurance industry. You have to prove your ability to manage chronic disease, diabetes being about one of the most complicated and most costly. We have principals in the organization, Mr. Sullivan and myself, who have been in the healthcare industry for many, many years. Our infrastructure partner is Mike Yam, who has built the platform. We've been doing this for 4 years, and it's taken 4 years to get this down to the point where we understand how to operate a healthcare logistics firm. Please, Jim. The total addressable market is in excess of $2 billion. We have many diabetic patients in the United States. It is dwarfed by comparison with those in India and those in China. And we have not even addressed the Asian market yet. That is clearly in our crosshairs. So we have a mobile model where we are actually taking the examination directly to the patients. We're doing it at YMCAs, at churches, synagogues, community health centers, etc. And we're dispatching our technologists not only to these locations, but actually to homes. We go to them. So we capture the images, upload them for review by specialists that we contact with in each state. Next slide, please. So we call our current offering iComply. iComply Plus, we've been asked by payers to add to this mix hemoglobin A1C, microalbumin, colorectal cancer screening. These are all additional, very easy to incorporate tests into our product architecture that we can incorporate at the same time we are encountering and interacting with these patients, whether in an outpatient setting or whether in their homes. Future, blood pressure, peripheral artery disease, a myriad of other components that we can add to increase and enhance our value proposition. The business model is very straightforward. We contract with health plans. They pay us between $130 and $140 per examination. Each examination costs us $52. Next, please, Jim. There are organizations that have endeavored to sell cameras to doctors in an effort to help them to capture more of the DRE examinations, the retinopathy examinations. They end up becoming expensive paperweights. We are mobile. We're providing home visits. We are providing technologists who are seasoned professionals in capturing these images to the satisfaction of retinal specialists, and that's a very select audience. Next, please. We have clients including publicly traded Medicare managed care organizations and Medicaid managed care organizations. We are now in the process of negotiating final agreements with United Healthcare, with Molina, and with Centene to provide a footprint on a national basis. Ergo, the reason we're here today. We need to expand clients. We are doing business today with United Healthcare, with Molina, and these other entities. Word of mouth among themselves to their peers has propelled us into other states, and they're asking for more and more of our ability to render this service in those markets. We're adding new health plans, back one, Jim, including Aetna, Cigna, Humana. We're engaged with every one of the major payers in the United States. And those that we're not engaged with yet, we will be very shortly. And we're also integrating and talking with health systems that have a vested interest in accomplishing the same thing that the insurance companies are looking for, increasing compliance relative to this measure. Yes, please. From the standpoint of what we're going to be using the funds for here in 6 states today, we will be in 15 by year end. Those monies are secured. Next year, we need to be in 37 states. And this is a very labor-intensive adoption perspective in terms of hiring resources, feet on the ground, to actually render the examinations on our behalf. Yes, please, Jim. Exit strategy, 24 to 48 months. Who do we think the potential acquirers are going to be? They're going to be companies we're doing business with today, whether that's United Healthcare, whether that's Aetna, whether that's Humana. These are entities that understand inherently the value proposition we're bringing, and they're going to be very likely coming to the, we noted, excuse me, it's on the next slide, actually. We've already secured 3/4 of that money for this year. Where we're really at is for quarter one of 2016, and we're looking for a $5 to $7 million infusion. Debt, equity, perhaps a combination of both. But this is where we need to deliver to provide the slides to you as well. Next slide, please. Why Heal Pros? This isn't a dream. This is a proven model. We're doing this. We've been doing this for 4 years. We've been asked by the largest health insurance companies in the United States to expand what we're doing in order to serve more of their members in more markets. We have national agreements in place, referenceable. We'd be delighted to share them with you. We are increasing the performance scores for the insurance companies. That is where a tremendous amount of their reimbursement is predicated. Demonstrating quality increases is what it's all about. It's called HEDIS and STARS, and again, I'd be happy to go into the details at your leisure. This is a unique, reproducible logistics model. It hasn't come easy. There's been a lot of pain, a lot of agony, but in 4 years we have figured it out, and we can replicate this and add additional services into this model very readily. That's our story. We're still to it, and thank you. Any questions?
Are you on target for 2015?
We are.
I saw one hand go up in the back.
Yes, please. Of the non-compliant diabetic members, we then do a heat map, geo analysis of where the non-compliant parties are. We go out and we target them, whether it's at a physical location or whether we have to go to their home. Our job's to go find them. Thank you. Thank you very much. Military backgrounds. We have a number of persons. It's ironic that gamers turn out to be exceptionally good at operating the cameras and learning how to capture the image quality that the retinal specialists insist upon. And we have very, very high standards as it relates to the quality expectations of the images. Because if we take fundus photographs and they're not interpretable by the retinal specialist, we've wasted the patient's time, we've wasted the insurance company's time as well as our own. Thank you again.